Let's speak once more to former NHS Administrator and health commentator Roy Lilley. Roy, apologies for dragging you on screen yet again to give a running commentary, but very important point from Professor Powis, of course, saying this could actually be the most damaging yet.
He's absolutely right. Consultants supervise the work of all the junior doctors, and there's very little really in terms of particularly of elective procedures that they can do without a consultant being either in the room or nominally in charge of the clinic. So there's a whole sort of risk issue now that the hospital bosses, the administrators and managers, they can't schedule the clinics and they can't schedule the elective procedures. Now, today there will be, I don't know, well over 70,000 people, I think perhaps closer to 100,000 people, who will have had that dreadful letter in the post saying, sorry, but, however long you've been waiting for your procedure, we're not going to do it because the strike is on. And you know what? We don't know when we can reinstate it. You're looking at, 3-4 months to reinstate these appointments. And that's really, I think, the hidden dangers of this. It's all very well for the consultants to say, oh, well, we're going to give Christmas Day cover and, the blue light in the front door will be safe and ITU will be safe. Fine. But what is not safe are for the people whose clinical priorities have got them to the front of the queue to be turfed off the waiting list. Now, these are people who might want a simple procedure like a pain blocker, really, for lower back pain, for example, sciatica, or it might be someone with sinister symptoms, query cancer, or it could be someone who's waited ages for a knee or a hip. Their family have taken time off work to look after them post-operatively or even drive them to hospital or drive them home. I mean, this is hugely disruptive. And for the work in the hospital, for the administrative departments, I mean, they are there to book appointments. They are not there to unbook appointments and rebook appointments. So it's unbelievably disruptive and I think very cruel for patients.
So, Roy, the basic pay for a consultant, taking into account this 6% pay increase that was recently announced, will be £93,000. Now, that is a heck of a lot of money for a lot of people. It can rise to, I think, over £120,000. So do you sympathise with what the public are saying, which is we don't have a lot of sympathy?
Yes, I absolutely do. I mean, to be fair to the doctors, they haven't had a proper pay increment. I mean, they've had odd increments over, but going back for nearly 10, 12 years, they haven't had a proper pay increase. And that does mean that the value of their pay packets has eroded because of inflation and all the other pressures that there are, the Ukraine war, costs of living, all of that, that has impacted. And you have to say, well, look, if you haven't had a decent pay rise in 10 or 12 years, what on earth has your trade union been doing? I mean, the BMA have been asleep at the wheel. The governments, successive governments, have taken advantage of the fact that they've not really pressed for any serious increments. And now, of course, the doctors have woken up to the fact that they're lagging behind. And if you look at OECD comparisons with other countries, you look at what doctors are paid in Germany and France and other countries like that, and Ireland particularly, where they're paid a lot more. Our doctors, we're about, I looked it up before I came on air, we're about 7 or 12 on the OECD list. I mean, the doctors really have slipped in pay. So that is true. Yeah.
But they can be paid, can't they, Roy, extra for private work?
Sorry, can you say that again?
Yeah, they can be paid extra for private work, can't they? I know not all do it.
Yes. I was coming on to that. So, I mean, I think they have that case, but I mean, the BMA's been asleep at the wheel, trying to recover it all in one go and putting, the patients in the crossfire, I think is cruel. And it's true what you say. Consultants, not all of them, but most consultant disciplines can practice in the private sector. It is regionally distributed, so you usually find it in the big cities, Manchester, Birmingham, London and Bristol, places like that, where there's quite a healthy private care sector going on. And of course, depending what you do, orthopedic surgeons and particularly anaesthetists are in huge demand. They can earn $300,000 a year in the private sector. So for them to say our pay has eroded, well, look, so's everybody else. Bus drivers, shop assistants, care assistants, everybody's in the same boat.
So what's the way forward, bearing in mind what we heard yesterday at PMQs, where the Prime Minister indicated that 6% figure is from an independent public pay review body? That's going to be difficult, I guess, for the unions to argue against.
It is. I mean, in the end, we know, don't we, that all these strikes end in negotiations. The nurses' strike ended in negotiations. They ended up with 5%. They didn't do so well, really. But it will end up in talks. What's likely to happen? Well, I think probably they'll have some kind of staged settlement over a period. They certainly, we don't really know what figure the consultants want. They've been actually much clever, I think, in their negotiations. By the junior doctors have said they wanted 35%. Well, there's no way they're going to get that. Yeah. The consultants have been much more subtle about it, and I think they'll probably settle for a lot less. But at the end of the day, we know, don't we, that, all disputes end in getting around the table and talking. The government have said, we've done 6% and that's that. Now, if they stick to that, and they may well try and do that, then we can see these strikes going on until Christmas, and that will do horrendous damage to the waiting lists and to hospitals.
Roy, sorry as ever, thank you very much for taking us through all the permutations. We'll see what happens, of course, as a result of this latest action. Thank you very much.